Hi there. I'd just like to talk about continuing education this morning and where you can get it from. I like to learn a little bit every day, a little bit being the operative word. Okay, I get bored pretty quick. There are a couple of websites and blogs that I subscribe to. The one this morning was The Manual Therapist, Dr. Urson Religioso, I think his name is. He's a doctor of physical therapy. He's fantastic. He's always looking for new ways to become a better therapist, and he's always educating himself. So what did I read this morning? It was an article about tissue deformation. Okay, so basically you cannot, as a therapist, with your fingers or your elbow or your knee, go and change, deform tissue, trigger points, whatever you are working on. As soon as you take your hands away, it'll go back to the way it presented in the first place. Okay? I'm just a facilitator. As a therapist, we facilitate. Okay? It's the nervous system that will decide whether a trigger point or an area of tension relaxes or not. So what does that mean to me as a therapist? Well, I have to develop my skills with my hands, my therapeutic skills. I cannot just go super deep with my elbow or my knee or my thumb. The deeper I go, I will go from elastic to plastic, and if I go too deep, I'll break tissue. Okay? So deep is not the way to go, right? My job is to try and touch people in such a way that they relax. They go from sympathetic, adrenaline, muscle holding, muscle guarding, to parasympathetic. And that's where we get results. Okay? I also read an article on asymmetry. Okay? So Dr. Religioso has just finished studying with the Postural Restoration Institute. It's a 3-week home study course for folk like myself that can't get to the workshops, okay? And it covers asymmetries. We're all asymmetrical, okay? A lot of us have got a right shoulder that's lower than the left, yeah? A lot of us, if you do this, you've got better external rotation on the left, I'm not pretending, than the right, okay? Reason being, we've got a heart on the left, we've got difference in the size of the lungs, we've got a big liver on the right, okay? So our organs actually will have a big effect on the way we move. A lot of us have got less rotation on the right and more on the left. We've got a anteriorly rotated pelvis on the left and a posteriorly rotated pelvis on the right. Okay? So knowing that, and I'm going to go and study this now, but instead of just looking at someone in a static assessment and coming back to deforming tissue, trying to get that right shoulder up, yeah, and trying to get the right hip the same as the left by using deep pressure, I can look a little bit deeper. I can use this knowledge, and it will make me a better therapist when I try to diagnose people, and it will make me a bit more realistic with the outcomes that I should get. Just a good book I remember reading as well, educational resource, Job's Body. One sentence that jumped out at me was, he said, you can't bully the body. And it's true. I used to massage so hard. I really used to hurt people. And you can't bully the body. You can't deform tissue. You can ask the nervous system to work with you and deform tissue in a beautiful way. Let people go back to neutral. Yeah. One other thing as well that I was reading this morning, and I forgot this. I knew it, but I forgot, so I reinforced it. When you find tension, okay, I had a lady yesterday, classical, shoulders, neck, occiput, headaches, okay. You work the tension, okay, but there's a reason why muscles get tight, and very often they are compensating for something that's not doing its job. What did I forget to do yesterday? The deep neck flexors, it's reciprocal. Tension at the back, well, something at the front's probably not working. I should have given her chin tucks as a home exercise program. Anyway, education, even in small bits every day, is fantastic. There's more than one way to skin a cat. There are some fantastic therapists out there that put out this information. They're passionate about what they do, and I think it's a good idea for all of us to follow their work, learn every day, and become better therapists ourselves. So I'm going to put these websites on my blog site. Check them out and enjoy it.